Medical Monday with the Center for Occupational Environmental Medicine. We've been hearing a lot about the integrative medicine and how major academic centers like Duke and Vanderbilt have opened integrative medicine centers. Doctor, can you tell us as much as you can about that, about the integrative medicine and what it's doing? Dr. William Weirs. Yes,
so integrative medicine is a patient-centered approach to healthcare, and so the practitioner and the patient are actually going to partner to come up with a treatment plan. We try to take all factors into account that can impact health and disease, and we're going to try to start whatever the treatment program is with the less invasive, the more natural approach.
Sure.
I guess you could say a more lifestyle defined approach. And we're going to kind of take all these factors into account to come up with a plan that works for both the patient and us.
With the integrative medicine, a lot of times you as a doctor, and we can just say this outright, sometimes people's lifestyle are not very healthy and they need to change that lifestyle. So it's very important for the patient to be very honest with you as the physician to say, hey, this is my lifestyle, this is what I do, this is what I eat on a day-to-day basis, and if I do get any exercise, it's going to the car and going to work and back. Yeah.
We see that a lot, unfortunately. I think it's just a byproduct of modern life. We're busy, we get up, we go to work, we spend all day in the office, but we're finding that lifestyle really is a major determinant of health and disease, and so it's the diet we eat, it's whether we exercise or not, it's whether we smoke or not.
Sure.
It's how we handle our stress levels. I mean, we all have stress, but you know, how do we handle it in a healthy way or unhealthy way?
Sure.
So when you put all these factors together, I try to coach people, and I try to coach myself into living a anti-inflammatory lifestyle, healthy diet, exercise, optimal sleep, optimal rest. And that's really the key to long-term health.
Because as yourself, as you do, you set a good example for your patients. That's what all doctors should do. You know, 30 years ago, a doctor was sitting there with a cigarette going, you know, you shouldn't be smoking, and they're sitting there smoking in the office. That's you cannot see, and you don't see that anymore. But you want to see a doctor as yourself that's in good shape, your doctors that are there at the clinic that y'all have, setting the example and understanding what each individual patient needs to go through and what they're doing right now to themselves, because what they eat, what goes in, is going to be coming out.
Oh, absolutely. Yeah. And I joke with a lot of my patients. I tell people right up front I'm not perfect. I too get into the sugar and the ice cream every once in a while, but for the most part, I kind of tell people the 80-20 rule. If you're good 80% of the time, I think you can get away with occasionally having a donut. You know, every once in a while. I probably shouldn't say that on camera, but yeah.
That's good. You know, a little something here and there, and everything in moderation.
Exactly.
Well. Yeah.
Exactly.
You're certified in integrative medicine?
Yeah, that's correct. I did a 2-year fellowship at the University of Arizona with the Center of Integrative Medicine. And it was fantastic.
Fantastic. Where's your office located?
We are at 7510 North Forest Drive. That's in North Charleston. Telephone number is area code 843-572-1600.
Doctor, thank you so very much.
Thank you.
Appreciate you being here. Got more coming up after the break, so stay with us. Thank you.